I will welcome Representative Agbaje to the committee, and I move that House File 1010 be referred to the Judiciary and Finance and Civil Law Committee. Representative Agbaje, I understand you have an A1 author's amendment?
Yes.
I'll move the A1 to get it in the shape the author would like us to consider it. All those in favor of the A1 say aye. 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 Those opposed? And the A1 is before us.
Thank you, Chair, and I'll speak to the bill as amended. Most of the amendments are technical on terms, making sure all the terms are uniform, and just clarifying some of the areas. So today I'm presenting House File 1010, which is the Minnesota Certified Midwife Act. It's a bipartisan bill in both chambers establishing a new pathway for midwifery in Minnesota. In the United States and in Minnesota, we have a maternal health crisis causing high levels of maternal morbidity and mortality. We know that there are stark racial disparities, and also across large areas of rural Minnesota, those areas can be considered maternity deserts. According to a March of Dimes report that was conducted in 2023, about 19.5% of our Minnesota counties are considered maternity deserts based on the availability of birthing facilities, maternity care providers, and the percent of uninsured women, and that statistic continues to get worse, unfortunately, and not better. Pregnant women in rural Minnesota must drive further distances for care, and maternal mortality statistics from the Minnesota Department of Health in 2017 and 2018 indicate that 48% of pregnancy-related deaths occur in rural Minnesota, even though that's an area where residents only make up about a fifth of the women giving birth. Maternity deserts in Minnesota are a serious barrier to accessing safe care. The situation will only become more dire as 1/3 of Minnesota's midwifery workforce is anticipated to retire in the next 5 to 10 years. Expanding entry to midwifery can help to increase access to more maternal health providers and maternal care. The certified midwife licensure is an evidence-based strategy we can implement in Minnesota to expand our midwifery workforce, increase its diversity, and help address maternity care deserts. Certified midwives aren't new to the United States. They have been practicing in 12 other states with this type of certification already. And in certified midwife certification in some states has also been around for at least 30 years. So by establishing a licensure for certified midwives in Minnesota, we will be introducing a new way to become a midwife, one that doesn't require becoming a registered nurse first to and so in order to receive the licensure under this program, you would need to graduate from a certified midwife degree program. That candidate would also have to complete the same science prerequisites, would have to have the same graduate level midwifery education, and pass the same type of certification boards as certified nurse midwives. This bill looks really similar to the scope of practice for certified nurse midwives, but most of the language changes only just reflect that certified midwives are not nurses. The midwifery scope of practice for certified midwives will be, but would otherwise be the same as a certified nurse midwife, except for the nursing part. Currently, right now, the University of Minnesota is poised to start a certified midwife program at the University of Minnesota, but they don't want to start that program until we know that there's a licensure program in place, and so that's what this bill seeks to do. I do have a couple of testifiers with me, so they'll speak to other aspects of the bill and other impacts that they anticipate the bill will have. Thank you.
Thank you, Representative Agbaje. And we have Mandy Huber up first, please. Please state your name, and good to hear from you.
Thank you. Mandy Huber, nurse midwife. Chair Bierman, Chair Bacher, members of the committee, thank you for this opportunity to testify in support of this bill. As I said, my name is Mandy Huber, and I am a certified nurse midwife, and I am on the board of the Minnesota affiliate of the American College of Nurse Midwives. We support, we educate, and we advocate for optimal health outcomes and access to care for all Minnesotans. We are working with the Minnesota Advanced Practice Registered Nurse Coalition to bring this bill forward, and it has been our top legislative priority since the year 2019. Certified nurse midwives, obstetrician gynecologists, and certified professional midwives are partnering on this bill, and together we agree that Minnesota needs more midwives. The certified midwife could be an essential and evidence-based piece of women's health care in Minnesota. Currently, in order to become a certified nurse midwife, a student must first attend a nursing program and become a registered nurse before pursuing graduate midwifery education. On average, certified nurse midwives practice nursing for fewer than 5 years before pursuing graduate midwifery education. With certified midwife licensure, Minnesotans could instead pursue graduate midwifery education directly after completing the necessary components of the undergraduate education, saving themselves and the state valuable time and funds. This would alleviate the strain on registered nurse education programs. Nursing school seats would instead be reserved for the people who would like to serve their communities as nurses. This is a vital consideration given Minnesota's persistent nursing shortage across the state. Support for this initiative is bipartisan in both chambers and also has strong professional and community support. Page 4 of the 2024 March of Dimes Minnesota report, which is in your packets, identifies that Minnesota has adopted 3 out of 4 policies that would improve and sustain maternal and infant health care in Minnesota. Certified midwife licensure is the only policy Minnesota has not achieved yet. Please support this bill. Thank you.
Thank you, Ms. Huber. Next, Dr. Siri Fiebiger.
Thank you, Chair.
Please introduce yourself and proceed.
I'm Dr. Siri Fiebiger, and I want to thank you, Chair Bierman and Chair Backer, for allowing us to bring this bill. I represent the Minnesota section of the American College of Obstetricians and Gynecologists, and House File 1010 is our top legislative priority this year, and it has been the last few years as well, because it will expand access to high-quality maternal care by creating this new pathway for midwifery licensure. Certified midwives meet the very same competencies and certification standards as the highly qualified certified nurse midwives who have specialized training in low-risk pregnancy, vaginal birth, and wellness care. These midwives are well-grounded experts integrating to higher levels of care as needed, and I find that they have made me a better obstetrician as I constantly learn new information from them every year. Expanding midwifery access is a proven cost-effective strategy that improves maternal health outcomes. States that have expanded midwifery access have lowered their cesarean and preterm delivery rates. I'll say that again. States that have expanded their midwifery care have lowered their C-section and preterm delivery rates, and they have higher breastfeeding rates and higher birth weights. A U of M study forecasted that if we expanded midwifery care across the country, it would mean the prevention of 30,000 preterm births and a savings of $4 billion over 10 years. Minnesota urgently needs more maternal care providers, as now 1 in 5 counties lacks any provider. And these maternal health deserts align with existing racial health disparities as well. Nationally, 80% of pregnancy-related deaths are preventable, yet the U.S. still has the highest maternal mortality rate among industrialized nations, despite spending more than anyone else does on health care. In Minnesota, women of color, especially our Indigenous mothers, face significantly higher risks of pregnancy-related complications and death, regardless of their education or income level. Midwives offer culturally competent, patient-centered care that can help mitigate these disparities. Importantly, House File 1010 does not debate the qualifications of midwives post-training, but it ensures equitable access to midwifery education licensure, creating a vital new pathway to enter this field. We must take action to ensure that all Minnesota mothers receive the care they need and what they deserve. By expanding midwifery licensure, we move toward a future where every mother, regardless of race, location, or background, has access to safe, high-quality maternal care. Thank you again for consideration of House File 1010, and I welcome questions and ask for your support. Thank you.
Thank you, Ms. Fiebiger. Next up, Rebecca Polston. Welcome to the committee. Please state your name and proceed with your testimony.
Rebecca Polston, certified professional midwife and licensed midwife. Thank you, co-chairs Bierman and Bacher, and members of the House Health, Finance, and Policy Committee. My name is Rebecca Polston, and I am a certified professional midwife and the founder and owner of Roots Community Birth Center, a nationally recognized freestanding birth center located in North Minneapolis, and one of the very few Black-owned birth centers in the United States. I am here to testify in support of the Minnesota Certified Midwife Act, House File 1010. As you have heard, Minnesota suffers from among the worst rates of health disparities in the country, including in maternal health. Black women in Minnesota are 2 to 3 times more likely to die in childbirth than white women, and while just 6.4% of Minnesotans are Black, we represent 15% of maternal deaths in our state. Maternal mortality and morbidity are also rising overall in the United States and increased sharply during the first year of the pandemic. The majority of these maternal deaths are preventable. At Roots Birth Center, we serve predominantly patients of color, and we are proud that our midwifery care model is nationally recognized for cultural competence, high-quality birth outcomes, and strong patient satisfaction. While working with the communities experiencing the highest disparities in our state, however, owing to the midwifery model generally and the birth center model specifically, Roots is proud of our virtually non-existent preterm birth rate. Our success supporting families to full-term healthy pregnancies, regardless of background, is unmatched. We owe our success to the midwifery model of care, and we achieve these outcomes with a population mix of 65% Medicaid clients and 35% commercially insured clients. But to do more, we need more midwives. We believe House File 1010 enacts a common sense policy to improve maternal health outcomes and reduce disparities in our state by removing the barrier to certified midwifery licensure in Minnesota. This would also help expand access to high-quality, culturally competent midwifery care in our state. Research from other states indicates that the certified midwife licensure leads to greater ethnic and racial diversity in the workforce. I'd like to thank Representative Agbaje for bringing this important legislation forward and urge the members of the committee to support the bill. Thank you.
Thank you very much, Ms. Polson, for your testimony. Next, we have a virtual testifier, Kylie Sari. Please introduce yourself and proceed with your testimony.
Yes, hello, Chair Bierman and Bacher and committee members. My name is Kylie Sari. I'm a certified nurse midwife living in Fairmont, Minnesota, way down by the Iowa border. I'm testifying in strong support of the certified midwife bill. Midwifery is a second career for me. I didn't grow up in rural Minnesota, but after moving here and living here for nearly 2 decades, I knew I wanted to serve my community in this way. I'm familiar with the specific needs of patients in this area, the resources available, and the culture that's so unique to these smaller communities. I began my journey to become a certified nurse midwife in 2016 by attending nursing school, as my previous bachelor's degree was not in nursing. After earning my BSN, I worked as an RN to meet the entry requirements for midwifery school. Once eligible, I enrolled in graduate midwifery school and completed my degree this year. It took me 9 years to complete this process and put me in significant educational debt. After all that, I'm unable to provide maternal and primary health care for my community. Although the local hospital was hiring midwives when I entered midwifery school, by the time I finished, they were not only no longer hiring midwives, they had closed the L&D department altogether, citing lack of providers. Not only does Fairmont no longer have the critical maternal health care access that it needs, but I have to move out of this community to work as a midwife. Many competent providers willing to work in rural Minnesota have a similar situation. This means less and less access to care in greater Minnesota. For my family, my friends, and my neighbors, I want to work here. I want to serve rural Minnesota. If the certified midwifery licensure was in place, I could have graduated and begun practicing midwifery earlier, 7 years earlier, with all of the required skills, education, and accreditation needed, without having to shoulder the financial and time costs of obtaining a nursing degree first. I would have been able to provide essential primary and women's health care to my community, and perhaps our OB department would have been able to remain open to our residents. Policies like the Certified Midwife Bill that expand healthcare access are not only beneficial for the state, but are desperately needed for providers and patients alike. Every year that we do not pass this legislation is another year lost on this important investment in our communities, especially in greater Minnesota. Please support House File 1010 to license certified midwives. Thank you.
And thank you, Kylie, for your testimony. Any other members of the public wishing to speak to the bill? Seeing none, we will move to member questions for discussion. Representative Liebling.
Okay, Mr. Chair, thank you. And please look around and see if anybody else wants to go first. That'd be fine, too, but maybe my questions will trigger some other questions. But Representative Agbaje, thank you. And we had a conversation about the bill, and I really appreciate it and would like to continue working with you on it, because I agree Minnesota needs more midwives, and I love midwives. And I had 3 children with nurse midwives were involved in their births. So I really, and that was obviously a long time ago. So I really appreciate the folks who do this work. That said, there are some things about the bill that I'm still not comfortable with. And one of them that I'd really like to ask about is, it's not clear to me. So what the bill is doing is saying that a person can come in and do the training to be a certified midwife and have exactly the same scope as the certified nurse midwife. So somebody who's been a nurse for however long, went through all of that training, all the clinicals with that, and that somehow that you don't need to do that. So my question is, what do you have to enter into the training? And tell me a little more. Is it a 2-year training? What exactly is the period of training? And a little more about what is involved in the training.
Representative Agbaje.
Thank you, Chair. I'll go to Dr. Huber about this.
Very good.
Midwife Huber, sorry.
Ms. Huber.
Thank you. Excellent question, and I'm really excited to explain. The prerequisites to enter the programs to be a certified midwife are very similar to those of any health science professional. There's all the undergraduate basic science courses, and typically one might need to pass like a GRE exam, and then they can apply to the midwifery school. Before that, of course, someone must have an undergraduate degree. Our testifier did not have a graduate or an undergraduate degree in nursing, so she went back to school, did the basic sciences, did the health sciences, got prepared, and then applied to midwifery school. When we enter midwifery school, there are many programs that educate nurse midwives and certified midwives in a combined cohort. When they walk through the doors, they may have different backgrounds, but when they leave the institutional doors, their graduate midwifery provider training has been identical.
Thank you, Chair Liebling. Follow up.
Yeah, thank you, Mr. Chair. For a couple things. One is, you didn't tell me how many years it is. I assume, is it 2 years? A 2-year program?
The graduate program is 2 or 3 years, depending if you will leave with a master's or a doctorate.
Okay, Mr. Chair, okay, and I will just make a statement, and then I'll let you all move on. But, so I still have some real concern about this, and one of the things I'd like to, and I'm sorry, Representative Agbaje, when we spoke, I had forgotten about this, so I didn't tell you about this, but if you look on page 2, on line 2.22 of the bill, it describes what the practice means. It essentially sets out the scope of practice. So what you have here, it says, certified midwifery practice means managing, diagnosing, and treating women's primary health care, comma, and then it talks about pregnancy, childbirth, et cetera. So to me, this women's primary health care, that's a really big scope. And I know this is probably mirroring the nurse midwife, but these are not nurses. They haven't necessarily worked in a healthcare setting before. I just have really a struggle with the idea that somebody can come in with another undergraduate degree and some science courses and be at the same level as a nurse, and then after 2 years possibly be sent out, and the scope of practice is extraordinarily large. Now, I know the argument is we'll know our scope and we won't exceed our scope, but we're saying that these are primary healthcare providers for women. They have full prescribing, and they are independent practitioners, so they can go and set up a shingle and practice independently. Now, I don't know. I agree. We need more people. We have other levels of midwifery in the state. this isn't the only option. I just have some concern about this still, and I hope to continue working with Representative Agbaje on this, because it would be very nice to be able to get to something here and get this done, but this bill, as it's written, still, for me, still is not it. But I'm open to working on it. Hope we can get there. Thank you.
Thank you, Chair Liebling. Any comments, Representative Agbaje, at this?
Thank you, Chair. Thank you, Representative Liebling. I appreciate the conversations we've had. I know we'll continue to have more of them. I think, there's still time to open up to figure out kind of, where's the best way to strike that balance. So I think we'll continue talking about that as we proceed. So I appreciate that.
Representative Bonner.
Oh, and I don't know if another testifier had something else they wanted to add, if that's okay, Mr. Chair.
Representative Agbaje, yes. You have another comment you'd like to have addressed? Ms. Fiebiger or Dr. Fiebiger?
Dr. Fiebiger, please.
Yes, Dr. Fiebiger. Please proceed.
This is a long-standing debate, Representative Liebling, around the qualifications of anybody providing primary care. And it's specific to my practice, that we have long-standing conversations with my family medicine colleagues, and that why would I be doing primary care? Because I'm an OB/GYN specialist. And yet, because women choose to come to see women healthcare providers, it's essential that we have this as our scope of practice. Because I don't treat non-pregnant people with hypertension. I don't treat non-pregnant people with diabetes, but I do diagnose it. And then I refer out. And so it's essential that our certified midwives, who are experts in women's health care, I sent my family members to midwives, my non-pregnant family members, because they listen well and they refer appropriately. And so that's why this scope of practice is exactly what it is, because we cannot limit the conversations that these midwives will have with the women who choose to see them first, because they know they listen, they take the time, they aren't on a production schedule like those of us in traditional practice are. Thank you.
Thank you, Dr. Fiebiger, for your comments. Representative Bonner, we have two more bills, and so if you can be succinct, I'd appreciate it. Thank you.
Actually, I was going to say, I'm just going to condense because I know we're short on time. I just wanted to say thank you for the bill, Representative Agbaje. Obviously, I'm a co-author of this bill. You know I support it. But over the years, I've heard more and more about midwifery and the experiences they go through, and folks who are passionate, not necessarily to become nurses, but because they want to be midwives. And I know that creating pathways to make that possible are really valuable. And everyone I have spoken to who has used that pathway, has used midwives in their practice, has been more than pleased, and I've never heard one negative comment. So I just want to say thank you for the bill. I appreciate finding some additional pathways to get there.
Closing comments, Representative Agbaje.
Thank you, Chair. Thank you, committee members. Appreciate your time today. I think I'll just say at the end, we're always looking for ways to increase access to health care for women across the state of Minnesota. Particularly in this space, we know it's a very turbulent and sometimes a traumatic time. I think a lot of people who are seeking to have children see pregnancy as somewhat daunting, but what midwives have been able to do, and along with the rest of the profession, is make that a little bit easier for more people in the state. And so I appreciate your time and consideration and your support in this bill as we continue to work it through as it moves through the committee process.
Thank you, Representative Agbaje. I renew the motion that House File 1010 be, as amended, be referred to the Judiciary, Finance, and Civil Law Committee. All those in favor say aye. 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 Those opposed? The motion prevails, and House File 1010, as amended, is referred to the Judiciary, Finance, and Civil Law Committee.